I just watch birds. I don't know much about them.
Well, I don't know anything about birds other than they fly.
You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast.
All right, everybody, welcome back to another episode of the NeuroRESET podcast. We have Aaron with us again. This is part two, but also we're talking about this because March is Brain Injury Awareness Month, right?
Mm-hmm. Yes.
And so it was actually Aaron's idea to have this podcast, and I'm super excited that she had that idea.
Yeah.
So today we're going to be talking a little more about, actually I'm going to let her introduce it because it was her idea, but we're going to cover a lot of cool stuff, some nutrition stuff, some maybe things about mental health, what we can do for diet and things like that if dealing with a brain injury or something like a concussion. So take it away.
All right, I will take it away. So since I'm in the driver's seat, I just thought it would be kind of neat to touch base on just how I focused on nutrition after my concussion and really focusing on really learning to actually listen to my body, which I realized I wasn't doing very well pre-concussion.
Mm-hmm.
So I learned a lot of things about myself after my concussion, but really listening to what your body needs is not easy.
Correct.
Especially when you're type A, perfectionist, it is not easy to kind of pump the brakes, allow yourself to rest, and make some changes.
For sure. Interesting, you mentioned type A. A lot of people are type A out there, both good and bad, double-edged sword. But, you know, when you're healthy, it's all good. The moment you hit your head, usually that turns in, I see, and we see, Dr. Rachel's behind the cam over here. You know, we tend to see that type A individuals turn into anxiety.
I can agree with that because I never had anxiety pre-concussion.
And then you'd mentioned depression in our discussion here. And usually what I tend to see clinically is people develop anxiety first, and then that turns into depression.
Yeah, I guess I could say I dealt with the anxiety first. And then I noticed, it wasn't until I looked back that I realized that I was depressed. So I think at the time I didn't really talk about it because I didn't really realize I was dealing with it.
Totally. Most people don't realize it until somebody tells them, oh, yeah, that's what this is.
Yeah.
It's pretty
like
crazy,
looked
right?
up some symptoms and it's like, oh, you know, reading some other articles and whatnot. It's like, oh, geez, like I guess I did have depression, but I didn't realize that at the time.
So what kinds of things did you learn throughout the concussion world? Like we covered kind of the neuro rehab side of things first in our first interview or podcast. What kind of things did we not talk about that you want to talk about today?
Well, I was very intrigued with how supplements and dietary changes for me, where it's not a diet, I guess I would say it's more of a lifestyle, where once I did start to see you, we focused on the kind of taking out like the grains, the dairy, and soy.
Yep.
Just to kind of reduce the inflammation.
For sure.
Because where I was at, I think it was at least quite a few months after post.
Well, yeah, it was enough for the person that referred you in to like, it's like, hey, do you have anybody, right? And so you're dealing with post-concussion syndrome for at least 2 to 3 months before we met, right?
Yes.
And so, so it's not every case is the same, but there's a handful of things from a supplemental side of things to the dietary side of things that show in the literature to improve outcomes in cases of concussion and like hypermetabolic states that are what happened kind of within the brain after a concussion. And so, I know also she is a big reader, right? And she started reading Grain Brain once you could start reading again. So it kind of like solidified some of the things that we had done, right? Which was really cool. So what was your diet like before? And then how did it change after?
So, I mean, I've always been pretty healthy. Like I've always been like a meal prepper.
Not just a regular prepper, but a meal prepper?
Prepper, yeah.
Okay.
I definitely took away a lot of my grains that I was eating. And instead of having grains I've always been like, protein, vegetables. So I made some dietary swaps where I took out dairy, which is very hard, and sometimes I'll still have it here and there, but I make sure it's like a good dairy, like some Manchego cheese or something.
Oh,
good
Manchego's
like
the best.
Oh,
You got to get the
so
old
good.
stuff. It's real hard.
Yes.
Oh, it's the best. The young,
So good.
the young cheese is like,
Yeah,
but the older the
got it.
better. Yeah.
Yes. So I did make those changes where I took out a lot of the grains that I was eating because, eat Ezekiel bread and some of those breads that you still think are healthy because they're like whole grain. So I did actually completely took those out of my diet and made some swaps with like sweet potatoes, understanding that I can still get my carbs that I need from fruits and vegetables and that all carbs don't have to be like the modified grains and breads and all that.
Yeah.
So I definitely noticed a difference with my digestive system, and I didn't feel when I do eat those every once in a long while when I'm just like, why did I do that?
Yeah.
It's like my body is just like I can feel a difference now digestive wise and also inflammatory, just kind of like bloating.
Yep. Now, you've read The Grain Brain.
Yes.
You read that during that time frame, right? Why is, because I'm sure a lot of people out there have read it. A lot of people listening haven't read it. But what's wrong with grains? Tell us a little bit about what you read and how you kind of applied that with some of the dietary stuff. Like, why do we need to get rid of grains?
From my understanding, it kind of helps to create, is it like a leaky gut kind of syndrome?
So that's one of the things that it can cause. So like grains can cause leaky gut syndrome. So if you're watching on YouTube, if you watch my hands, leaky gut syndrome is where basically we have like a little chain link fence in our gut, and then it starts to increase in size. So larger molecules get through the fence, right? Think of like a chain link fence, like a baseball stadium or, high school.
Yeah.
The gate swings open and stuff gets in that shouldn't get in.
Shouldn't get in.
But if
to
it's
the
small
bloodstream
enough,
and everything.
it'll like come in and out through the actual small holes just fine. That's normal. So those are foods that are broken down enough that
can
we
make it
actually
through.
absorb and use for nutrients and stuff like that.
Yeah.
But it can cause leaky gut because it's irritating to the gut.
And then the other thing I understood was inflammation, more of like systemic inflammation and with your brain, which you don't want your brain to not be able to heal if it's still inflamed.
Correct. So what she's describing there is when you hit your head, there's a natural inflammatory response that occurs. And what's really interesting is most people out there, it's like we're just it's kind of beat into us. You got to reduce inflammation. And so you take curcumin, resveratrols, all sorts of different products and things to decrease inflammation, which is overall in the grand scheme of things, it's excellent, right? But when we deal with a concussion, let's say an acute concussion, if we had met 2 days after your concussion, I wouldn't have introduced anti-inflammatory stuff right away.
Okay.
There's a couple of different trains of thought on what I'm getting ready to talk about, but I've used this pretty successfully most of my career, and we basically want the natural inflammatory response of a head injury to occur. Right? There's a natural process that takes place where it cleans up the debris of all the broken areas, right? Injured parts of the brain. You've got all sorts of things just floating around in there, and our immune system comes in with our microglial cells and basically cleans everything up. And so we want that to happen. Real quick, do you watch movies?
Not really.
iRobot? Did you ever see iRobot? Has
I know what
anybody
it
seen
is.
iRobot? Everybody's shaking their head no. So
Sorry.
it was a Will Smith movie back in the day, but it was projected into the future where basically robots are helping everybody, right?
Oh, interesting.
Well, long story short, there's this massive, like wreck in this tunnel, and he's involved in it, and the robots were attacking him, and he gets away, bumps and bruises and stuff, but all of the cleanup robots came in, cleaned up the mess as if nothing happened.
Oh,
So that's what it physically looks like when, like after a head injury, you want that cleanup crew to come in and start cleaning stuff up naturally.
Okay. That
So,
makes sense.
and that process usually takes anywhere from 2 to 4 weeks, and most people recover within a month. That is a typical like response to a concussion. Now, the recovery should happen within a month. Most people these days doesn't happen in a month. Now, they can be asymptomatic, but they can still have an inflammatory process happening.
Really?
So we need to understand as clinicians and patients out there, if you've had a concussion, if you've had multiple concussions, that inflammation can be continuing, right? So as an example, and I'll come back to the when we start to do stuff, but something like CTE, chronic traumatic encephalopathy. that has been shown to actually be happening more in, say, football players that have constant head trauma. So like linemen, linebackers, maybe some running backs, but generally we see it more on like the offensive line and the linebackers because they're always hitting people.
Yeah.
Receivers aren't always getting hit. Running backs aren't always getting hit, right? But it's that constant low-level trauma that allows the inflammation to maintain over the course of their life that creates that CTE.
So it's like they never get out of that.
It's like they never get out of that inflammatory response. Correct. Yep. And so for us, we want that acute situation to kind of run its course. So 2 to 4 weeks in is when we or I start to introduce supplementation. And I'm cool with dietary changes right away because you have like these hyper metabolic states that happen. And so you're starting to produce, you're basically not consuming blood sugar and things the same as you were before, and fats and ketones and all that stuff. So generally we promote a low carb diet, or like call it a grain-free diet, could pretty much act as the same thing. Even a ketogenic diet works well. You want to do that early on so that it kind of speeds up that process and it starts to stabilize your system a little bit faster.
Okay.
Yep. Then in that 2 to 4 week range is usually when we introduce supplementation, all the anti-inflammatory stuff, things like that. So that's basically what we did with you, and but that's why we did it.
It makes sense. And then one thing I think I asked you about earlier that I read in the Grain Brain book is the cytokines. Is that how you pronounce that? Can you explain a little bit about the cytokines?
Yeah, so your cytokines, and you guys have heard about this stuff more recently with COVID, but cytokines are essentially your inflammatory responses. Okay. Right? So you've got things like interleukin, so like interleukin 6 or IL-6 is a big one. What is it? I can't remember the others at this point, but you help me out, Doc. And so like really inflammation is not good to have in a chronic state. Okay. Right? And so inflammation goes up, and then usually our cortisol system increases to try to dampen the inflammation. But if it's chronic inflammation, then cortisol is chronically elevated, then we develop new issues or blood sugar issues or inflammatory or fat storage issues. All sorts of issues can come from inflammation, but it's like the cortisol elevation and the disruption in blood sugar and then the fat deposition. It's like this snowball effect that happens when you hit your head and the inflammation doesn't stop. So, in certain situations, like say a car accident, it's like even though you had to cover the supplementation for it, it should have probably been covered through the car accident. Yeah. It's not the world we live in, but like we had to do what the patient needs, even if there's a small financial investment, within maybe $100, $200 a month on certain products for a short amount of time to get that to stop, well worth it.
And that's the one thing that I realize is just making that investment in your health, whether it's the supplements and also eating healthy is not always cheap.
No, it's not, but it's worth it. It's certainly worth it, right? I always offer Dr. Rachel these chocolates that I love here, and she never takes them. So
good for you.
I know.
Wow.
Meanwhile, I brought in the organic, like little fruit stick thing today, and like half the box is gone already. So they're not, I know their secrets now. So let's go back. Let's jump back to it. Talks a little bit about some of that mental health stuff that you dealt with.
Yeah, so I think I didn't really understand, I guess, with the depression, like what part of why do we get depressed after concussions? I think for me, if I had to explain it, I feel like my brain was still trying to understand like the new me. And then also it was a little nerve-wracking to socialize, so I really didn't socialize much because verbally socializing with people, like you have to keep up with the conversation. You have to be paying attention to information, and it's just like information overload. So it just was like easier to semi kind of cut myself off from like the social environment. Or I learned how to, if I was hanging out with like my mom or whoever, where I did feel comfortable speaking up and saying, hey, like I'm like on info overload right now. Yeah. Like that was the one thing I did learn, to speak up, especially when I just felt like I couldn't handle like any more of a conversation. Yeah. So sometimes it was easier just to, I live alone. Yeah. So that makes it a little bit easier. Sure. But yeah, I definitely think that the depression part after a concussion, I don't think that's really talked about enough.
Right.
And I think just in general too, it's like people don't really want to talk about like when you're, you know, just laying on the couch like for a couple days on the weekend, which, you know, is like, that's not normally me.
No.
So like looking back at it, I was talking to one of my other friends that is dealing with like a concussion too. And we were just talking about kind of like that downhill slope that you like mentally take, where you just like want to lay down, like you don't like want to do anything.
Yeah.
And for me, that's like very abnormal. So yeah, looking back, I was like, ugh, like I wish I would have recognized the signs to like maybe speak up and say something like, hey, I'm dealing with this.
Yeah. And thanks for sharing that. It's really, really cool to hear that, because we know everybody else is probably dealing with that deals with concussions, right?
Yeah.
And from a physical brain like structure standpoint, what happens in concussions, like you might get the side, like basically your head shakes around, so you're going to hit the sides on the skull, but you're also going to get this twisting and shearing effect, which actually impacts the nerve transmission more than just like the bonk on the side. So when we're talking concussions, you're not going to see anything on an MRI, so to speak, or a CT. There's going to be no blood, right? And so there's no hemorrhaging, none of that. So it's more like a bump or a bruise.
Okay.
But also the pathways get twisted, kind of like you twist up a shirt and wring out like a towel or a wet shirt. So as you wring it out, it kind of deforms the nerves a little bit. And that's what causes all the widespread issues.
Interesting.
Okay.
Okay.
And so let's say we have a whiplash, right? We get rear-ended, or we rear-end somebody, or we hit somebody, right? Well, as we kind of whip around, our brain is just moving around inside the skull, kind of like an egg. If you can imagine just shaking up an egg, it's going to move and twist and all sorts of stuff. But our brain is that stalk that's connected to our spinal cord.
Yeah.
So it's anchored, so it's just going to whip back and forth and twist a little bit. And so if we hit the frontal lobe, guaranteed we're going to have anxiety or depression. We're going to have cognitive related issues, decision issues, emotional instability issues, focus attention issues, stuff like that.
It's a lot of issues.
A lot of issues, right?
Yeah.
And so from a physical standpoint, hitting your head can cause that. What you were describing is like the behavioral changes and the almost like psychological changes that come along with that, where and by the way, we need to clear this up of what I said from the last episode that we did, because my mom heard the part about I can't tolerate my mom. And I was like, no, that's totally misunderstood, right? So what we mean by this, Mom, is that when you hit your head, everything goes haywire. And when you hit your head and the pathways go, it changes the integration and it changes your tolerance, right? How much stimulation can you handle, whether it's TV, somebody talking? Because when we have a conversation, I have to remember what you said 2 minutes ago to be able to maintain the point that I'm talking about, to then get to the point and then ask maybe a follow-up question, right? So normal interaction. So it's this multiple, what we call dual tasking event or multi-step type of action that we have to carry out over the course of, say, 5 to 10 minutes. And if we can't tolerate that, we're going to gas out, or we're going to freak out, or our symptoms go through the roof. We get a headache. We can't focus. It's like, whoa. I got to stop. And that's what I meant by I can't tolerate my mom. If like I hit my head, it's like I can't tolerate anybody. When you hit your head, you're like, I can't think, I can't focus, I can't remember what time I'm supposed to be anywhere. Depends on the severity, of course. But that's what you meant when you brought up your mom. Like you felt comfortable telling your mom, but like your friends, because you look the same, but they don't know what you're going through.
Right.
And so it takes a lot to be able to share that. So that's one of the reasons I'm thanking you today, right?
Yeah. And I think that was the one thing that was really helpful is I had at least one really good friend that had a concussion, or actually she had two concussions when she was younger. So I was actually able to talk to her about my symptoms, and she understood exactly what I was going through versus the majority of other people. You talk to them and you can see like in their face, they're just looking at you and they see that you look normal. It's like, well, you can't see my brain. And even if you could, you can't see the damaged neurons because you're not an EEG.
Right.
Yeah.
And it's the world of like that mental health. Oh, so going back to the behavioral changes,
Oh,
right?
yes.
So as
Squirrel.
you start to develop a little anxiety, you start overthinking stuff. Well,
Oh, yeah.
what is I'm trying to go out with the girls to brunch. You're like, okay, is it going to be too loud? Am I going to be able to handle it? Do I even want to have a cocktail? What about the food? My stomach's kind of weird. So
Parking was like my first.
Oh
yeah.
my gosh. So things
Like,
that I
that's where-
didn't even occur to me, like the
Directions, like if I haven't been there before, my brain would
like spatial
spiral.
orientation type
Yes.
stuff. Yep. So you're dealing with spatial orientation, driving the vehicle, having anxiety from being hit in a car. A lot of people have anxiety just driving after the fact. So you got driving, you got parking, you got dealing with the environment that you're in. You've got maybe one friend that talks too much. The one that embellishes on their stories, and you usually can tolerate it, but you don't anymore.
Yeah.
Like, what are you going to say? Like, what if something comes out? Like, they think it's you, but it's not really you.
Right.
So you can see how this could completely spiral out of control and cause you to just avoid everything,
Yes.
right?
'cause
We call
that's
that an
easier.
avoidance behavior.
Yeah.
It feels better.
Yes, it's comfortable.
Yeah, it's comfortable.
Yeah.
You don't have to worry about anything else. But then when you are secluded, right? We all went through COVID. Like, as we are by ourselves, we clearly know that we need human interaction.
Well, I mean, I still worked, so.
Well, yeah, it's
Yeah.
not the same as brunch with the ladies, right?
No,
but at the
yeah.
same time,
But that seclusion, yeah.
I have to go hang out with friends every week. Every week, if I don't do that, I start to go absolutely berserk.
Really?
I go stir crazy. So that's why I'm like so animated here at the office, is because this satisfies that to some degree, right? Like, I'm not gonna lie, I love going and having like a cocktail with the boys. Like, old fashioned is my game.
Oh, yep.
Boom. And so with like, if I don't do that, I start like pacing around the house.
Really?
I'm just a very, very social person. So if I get a head injury, which I've had in the past, I basically just stay in the house, and it sucks.
Yeah.
So you start getting irritable, all the things that come along with kind of that depressive side of things.
Yeah.
And sure enough, you've got this whole recipe of inflammation, of a brain injury, of this behavioral modification, fear of going outside or doing other things. You develop the avoidance behavior, and then that just spirals all the anxiety and depression in and of itself.
Yeah, it is a big spiral.
Yeah.
Yeah, that is a good way to explain it.
And so,
And then it's like you kind of spiral out of it.
yeah, and because
Yeah.
your body is still trying to heal that whole time. If it's in a state that it can heal, it will.
Yeah.
A lot of people, almost everybody dealing with post-concussion syndrome isn't in a state of healing, because they would be better already, right?
Yeah.
And so whether it's from the fight or flight system being too high, there's too much inflammation, your system was really stressed before, or you were like firing up almost near the red line because you're a type A person, and when you hit your head, it moved into the red line. So now it can't calm down on its own.
Yeah.
So then we do all the exercises, we get you down into the regular RPM range, and then your body starts to heal naturally.
Do some breathing exercises. I did a
Breathing
lot of those breathing exercises.
Oh, yeah.
Yeah.
The new ones
Especially
are even
at
better.
work.
The new ones are even better.
Have you taught me those ones?
No, we do a 5-15 breath. We used to do 4-4-8 with you.
I like the 448.
Yeah. 4-4-8. I mean, there's so many different kinds. I use 5-15 now because our vagal nerve stem PhD owner of Hoolist, he did all of his testing with those different breaths, and he's
Interesting.
made one of his settings the 5-15, and that calms people down the most.
Really?
Yep.
So in for 5.
In for
exhale.
5, exhale through in through the nose for 5, exhale through the mouth for 15. 3 breaths in a minute. Usually we do a couple of minutes at a time and then
Okay.
take a break. If you're in an acute stage and really symptomatic, it will make you dizzy or give you a headache or something. So
Okay.
you got to do a little bit often
Often.
as opposed to a lot in one sitting.
I'll have to try that one.
Yeah, because the system's very unstable after a concussion, so anything is going to be too much for it. So Dr. Rachel and I, we pride ourselves in only pushing as hard as the nervous system will allow. And we always do our checks, keep eyes on people and stuff like that. So let's go back to some of the nutrition stuff. So
Yes.
do you recall any of the products that we put you on? What, like the type of product that it might have been?
DHA, which
Okay.
I still take 2,000 to 3,000
Yep.
milligrams a day.
And so it was probably a brain EDHA product at that point. So
Yes.
DHA and EPA are part of your omega-3 fatty acids. So the EPA aspect is going to be more for your peripheral system. Say, think like body inflammation, gut
Okay.
inflammation. And then your DHA is going to be a little more specific to brain.
To brain.
And so a lot of products now have kind of even numbers between EPA, DHA. Depends on the product, but generally those are going to be okay. A therapeutic range is different because like one capsule is often anywhere between 800 and 1,500 milligrams, or 800 milligrams and 1.5 grams.
If you're lucky, like, I mean, it took me a while to find like a good brand that
Right.
had a decent amount.
And so with that in mind, the therapeutic range from everything that I know and that I've used is usually between 3,000 and 5,000 milligrams, or 3 and 5 grams.
Okay.
That's like a therapeutic range. I've heard people go up as high as like 10,000, but 3 to 5 is going to be super safe. It's not going to make your stool any slicker than any, but that's one thing you got to worry about is like slick stool. So omega-3 fatty acids, specifically DHA, is for the brain. And so we prescribed that, I believe.
Yes.
And then what else?
I'm having a brain fart. The one that goes through the blood-brain barrier.
So that's going to be a magnesium L-threonate,
okay.
which we just custom formulated some products, and so we're calling it Brain Mag. So we'll have that here in probably the next few weeks, I'm thinking. But I like the powdered version because it's flavor, mixed berry.
Okay.
Is that the one that you used? I think it was, yeah.
Yes.
And so tastes super good for a supplement, I think. And so the reason
it did taste really good.
the reason that we use the mag-threonate is because magnesium L-threonate is the only form of magnesium that passes through the blood-brain barrier. So it essentially is brain specific, right? So what it does is, if we had something to draw on, I would draw it, but generally magnesium, so within each cell, there's call it a receptor, right? So stuff enters in and out of that receptor, and it should be calcium. So calcium, in the state of a head injury, calcium tends to fly into the cell a little too fast. And it makes cells fire off a little faster than they should, right? Because it's a positive ion, and it increases the action potential. Okay? So let's call, for anybody who's watching, let's say at the level of my eyes is the cutoff line to create an action potential. Okay? Then we have our resting membrane potential. So that's going to be below that line. So we have more net negative ions in the cell. Okay, this is the whole Circle K thing, back from like cell physiology, and so we have a net negative charge in the cell, and in order to activate the cell, we have to bring more positive ions in.
Right.
So when we do activation, whether it's exercise, stimulation, eye movements, leg movements, people talking to you, all of that is activating these cells, and it's starting to influx more calcium. Well, in the concussed brain, there's a magnesium plug that blocks that cell, or that receptor, to keep calcium at a normal level.
Oh, interesting.
And so when you get a head injury, you enter this hyper-excitable or excitotoxic state where your brain's firing it off on its own. Nausea, headaches, light sensitivity, sound sensitivity, everything's way too sensitive because that level of stimulation is more positive and it's right there next to the line, or it's over-activating. That's like, like I have a constant headache. I see things that aren't there. I hear things and I smell things. Like those are those receptors firing off that are associated with those different parts of the brain. So we give magnesium in the form of L-threonate. We call it, what do we call it? Brain Mag. And so we give people Brain Mag, and it goes in specifically to the brain, and it starts to plug up those receptors, so it decreases the sensitivity of all the systems in the brain.
Is that why we take it at night?
And it helps with sleep, helps calm the brain down a little bit. Yeah, so that's why we do it at night.
That makes sense.
In the early stages, you can certainly take 2 servings a day, in the morning and in the evening. Just depends on the case.
Yeah, I think I was doing twice a day, but now I just do it at night.
Yep.
In the evening.
My wife's been yelling at me to get more of it. I'm like, hey, we're private labeling, so let me get some stuff. We'll have it here in the next couple weeks. So
She has to wait 2 weeks. That's a long time to wait.
I know. Trust me, I'm on the receiving end of that. So, but yeah, so we've covered omega-3 fatty acids, specifically DHA for brain, but you're fine doing kind of a combo omega product. Generally, we want to hit between 3,000 and 5,000 milligrams, or 3 to 5 grams per day. And it's always based on tolerance. Check with your doctor, all these things, right?
Yes.
But that's like a good, healthy therapeutic range. Magnesium L-threonate, or in our case, Brain Mag, you're going to be doing at least 1 serving a day, if not 2. Okay. The other things we do is simple products like curcumin. That's going to help decrease the inflammatory response. Curcumin or turmeric.
Okay.
It depends. You can take up to, usually will dose 1 capsule 3 times a day.
You do that now?
I will if as needed.
Oh, as needed.
And so in like a therapeutic dosing, I'll dose like that because there's a half-life to all these products, right? So just like Advil is going to be, 4 hours or so? Excuse me. And so like magnesium, or not magnesium, sorry, the curcumin, you're going to want to take that multiple times a day, not like one big anti-inflammatory thing in the morning or the evening, kind of spread it out throughout your
So
day.
it kind of just stays in your system.
Exactly.
I will say the one thing that I learned with the doctor that I was taking care of me before you, I didn't realize that, when you go to like Sprouts or stores, you just think if you're buying like a good brand of a supplement, that it has like everything's like regulated with the amount that they're telling you that you're getting. And I didn't realize that you really have to pay attention to the labels. Like, so I've paid attention to like the third-party testing, like which brands do that. So now I'm very careful with the brands that I go through.
Correct.
Which I usually use like Nordic now for my DHA.
Yep.
I
And
do a
so,
subscription because they have like the 90 capsules and it works perfect. I don't have
Of
to
course.
forget about getting it or going to the store and then they're out.
auto ships are the best.
Yeah.
So what Erin's talking about is, as an example, most of the products that are going to be in a physician's office are going to be third-party tested. Even within the third-party testing, there's another level that you can go to. Certain companies do
above
their
their
own.
level testing?
And what I'm going to describe is the products that we use or are going to be using here.
Okay.
They order products. So basically ingredients, and then they do testing in their own office in addition to the testing that's already done. So they have a slightly higher level of approval zone, call it, right? A slightly higher rating that they need to hit for them, for their products.
Okay.
So if they test below that level, they send it back to the company that they got it from.
Well,
Guess where that product then goes? To the other companies.
to the other companies.
And so a lot of times we'll have products that are on back order for that reason. So we're waiting for the best ingredient to come through.
Wow.
So not all products or supplements are created equal. You can find good stuff at all the stores. I'm not saying not knocking them, but I'm saying in certain situations, you probably want to wait or go the extra mile or spend the additional dollars to invest in a much higher quality product.
Yes.
And so
Like I did start getting like for my multivitamin and it's like my daily multivitamin that has, is it B6 or B12? Is that the methylcobalamin?
Yep.
So I get Thorn. So that's the brand that I started using. So same thing, I do shipments with that. You get like 10% off, but
Yep.
at least I know I'm getting like what's in there and it's a little bit more regulated.
So, interestingly, Dr. Tate and I, she's a naturopath that we work with. She's in episode 2. We talked
I
a
did
little.
watch that
Yep.
episode. Great
So we
episode.
talked a little bit about cyanocobalamin, which is very commonly in all your multivitamins and the B12 that you get from all these other stores and things like that. Well, cyanocobalamin, and actually I think Gary Brecka talked about this on the Joe Rogan podcast. Cyanocobalamin is essentially a poison, like the cyano aspect. It's like a cyanide derivative of some kind. So it's not necessarily healthy for you. It's just combined to try to deliver this B vitamin, right? So cyanocobalamin, you want to make sure you're not getting that one. Generally, most people are going to do better with a methylated form of cobalamin, right? Or of B12. And so anything that we use is going to be methylated,
Okay.
like 9 times out of 10.
Is my understanding it's readily available at the cellular level? How does that work?
Yeah, so a lot of people have genetic related issues that, like an MTHFR or the motherfucker gene, right? And so the MTHFR, if you have a positive 1 or 2, what do they call them, alleles? So a homozygous or a heterozygous, if either of those are positive, you're not going to process B vitamins as efficiently. And methylation is involved in almost every formation of neurotransmitters and all sorts of other things in the human brain. So you need to make sure that you're having a readily available supplement if you have genetic issues. Most people that I know have at least one.
One. Oh,
Like every test that we've done, somebody's come back with one at least, if not two. So then you have to support those genes with very specific methylated products. So that's where that comes in. Now, do we do that in a concussion situation? Not necessarily. Usually we go with rehab first, dietary changes, and the basics, which come back to the omega-3s, the magnesium, some anti-inflammatory support that we start usually 2 to 4 weeks in. We do things like curcumin. We do things like resveratrol. I will add in things like probiotics or even gut lining repair, because the moment you hit your head, within hours, we're talking 3 to 5 hours, your vagus nerve starts to break down, which then starts to break down your gut. That's why so many head injuries start dealing with digestion issues.
I did the
glutalamine, probably.
Yes.
Yep. And so we're going to end up getting that one. I don't remember if I don't think we private labeled that just yet, but it'll be some kind of
But yeah, I
super
never knew
fun
about
gut
the
thing.
whole vagus nerve thing until I saw you.
Yep.
And then things started making sense.
I just talked to another patient today. They sent a message in that they went to their naturopath, I believe, a functional medicine specialist.
Okay.
And that person was trying to change their hormones, their cortisol levels, all sorts of stuff for a while. And after, not even 2 months of rehab, vagal nerve stimulation, red light therapy, laser therapy, PEMF, and brain rehab, their labs have changed to the point where that practitioner is like, I'm sending all my people over there because of this vagus nerve thing.
Wow.
The function that we're seeing lab changes after doing neuro rehab.
That's amazing.
And what we're doing here. So
because it really is life changing.
If you do it right, if you do the right stuff with the right amount of stimulation at the level that the patient can tolerate, I mean, we see so many cool changes. But also, we can push people too hard, and it's not pretty when we do. But usually it's only the first visit, and we just couldn't tell how sensitive that system was. So we put most people through like a 3 to 5 exercise kind of regimen that first day, and that's our test to see what they can handle.
Oh, that makes sense.
Some people, we just start off with passive care and just do that for 2 to 4 weeks to get them up to speed. And in fact, we're seeing a change in one of them just now that, they've been doing 3 or 4 weeks now? Probably 2 to 3 weeks. Yeah. And I didn't meet with them today, but these guys talked with her, and they're like, she's went on vacation, she's dancing, and this poor kid was like bedridden.
Oh, wow.
Bedridden. And just in a few weeks, we're starting to see some really cool changes.
That's amazing.
So, neuro rehab for the win. Hoorah! Right? But neuro rehab isn't just the exercises, right? It's the whole kind of encompassing the brain-body biochemistry. We're talking about the brain and the biochemistry today.
Yeah.
Right? We've talked about body stuff. You get whiplash, we take care of the neck. You can run MRIs look at disc issues, which I don't think we ever did with you. I don't recall, but
no, I just had a cervical spine series of X-rays, but I think a different doctor. Yeah.
And for the most part, you're fine at this point. So we do see Aaron, I'd say fairly regularly, just for maintenance, and
just kind of fine tuning things.
Yeah,
which is
like little tweaks as they happen, and we clean them up before they become a bigger issue. And I was just talking with somebody else today, and and Dr. Rachel can say the same thing. It's like the people that maintain, they don't ever really have any flares. It's the people that are like, I choose not to maintain this investment that I've put in. Okay, cool. See you in 3 to 6 months, and you're not going to feel good, unfortunately. Yeah. So, is it permanent to some degree, right? But if you don't work out, you're not going to be ripped, right? You gotta put something into it to make sure you get something out of it. And
and that's the one thing I've learned is whether it's going to the gym and working out or focusing on my neuro health, it's like that investment. I just think of my investment now in my body, it's either I'm gonna either pay for it in the future if I don't take care of myself now, or especially back then when I was dealing with my concussion symptoms, I can go back to a crappy diet, or I can make these changes, which not everyone's gonna understand. You have to sit there and explain yourself to everybody, but you know what? It's not their body; it's my body that I have to live in. So if they don't understand it, I just don't really care.
Totally.
And I still enjoy my old fashions
for sure, right? 80-20 rule, 90-10 rule, and people say, or some of these philosophers say, you can pay now to be healthy, or you can wait till you're sick and spend all your money trying to be healthy.
Yep.
Right? And so it's much easier when you're not trying to climb out of the pit of misery, which I call it. It costs so much more to get you out of trouble just to then try to maintain some version of health than it does to spend a little bit more now to create health before it ever becomes the pit of misery, right? And so
it's a lot more backtracking to do, I feel like, once you get
it's
that
like
far
pushing
along.
a snowball uphill when people are really, really sick. I mean, head injuries happen, but we know what to do with them to get them better.
Yeah, and I definitely learned. I personally think I'm healthier now after my concussion, because it did make me realize I needed to focus on whether it was my mental health or my physical health.
Yeah. So in a way, it's like that injury that happened is almost like an opportunity. If you look at it as like a victim, guess what? You're going to receive victim mentality stuff coming your way.
Yeah.
But like you're healthier, you seem healthier, happier, you can read more, you got all the things going on, you're pretty well dialed in. And so.
Yeah, definitely. I think it makes you feel like more resilient when you just kind of like own like that healing process.
Yeah, I agree. I totally agree. Well, I appreciate you bringing this up and scheduling this podcast because it is Brain Injury Awareness Month. And I hope that our listeners are able to resonate with your story, but also the nutrition and the supplementation that's available. Like there's nothing you can do, right? There's a lot of things you can do without even coming to see us. So it's going to be your brain-based support products. So it's going to be your omegas, your DHAs, your magnesium L3 and 8s, your anti-inflammatory responses. Anything after 2 to 4 weeks, you can pretty much just start the anti-inflammatory cascade or supplementation. Things like resveratrol, quercetin, maybe some potential blood sugar support with dietary changes, a little more keto, maybe grain-free paleo style works well.
Which isn't really that bad.
It's
Let's
not.
get
No.
creative.
Yeah.
Yeah.
It's hard when you have a brain injury to change all that up and know what you're shopping for and parking and all the things that I get everything on the list. But at the same time, it's
I eat like the same meal
totally.
for
I could
breakfast,
eat the
lunch,
same
and
thing all
dinner,
the time
so
too.
That's easier.
So we've got all of our supplementation, our gut lining support, our probiotic support, and also we're now using a stool testing company that actually tests all of the normal infectious stuff. It tests all of your normal, I say all, everything that we know they can test of your normal commensal bacteria. And then they create customized probiotics for you based on your results. So we've been using them for maybe a month. We've got a couple people on them. We've got one report so far of like, I feel amazing on this stuff.
Really?
So
Wow.
we're all doing that as a team, not like together, but like we're going to go through the process and we're going to go through the customization side of things. And if anything's there, we'll treat it. If there's nothing and we just need basic support, we get 3 months of support with that test kit. So,
That's awesome.
so it's like $349, and we can just set you up with it. It's no insurance, anything like that. So it's cash pay, but it's got 3 months included in that price.
Oh.
So that's something that I would look at doing on the next post-concussion syndrome case I see with GI issues for sure.
Oh, yeah.
Yep.
That'd be very
It's like
beneficial.
a great value. So yeah, probiotics, gut support, anti-inflammatory support, omega-3s, magnesium L3 and 8 because it passes the blood-brain barrier. Decrease your carb intake, maybe increase your protein and fat intake. You could call it keto, you can call it paleo, you can call it Mediterranean, you can call it the Aaron special. But that is really what you guys need to do if you're dealing with post-concussion stuff. And you have Erin to thank for this because she's the one that initiated this podcast today. So thank you very much, Erin. I appreciate you for coming on, number 2, and I'm sure we're going to have another one in the future. But thank you all for listening. Again, this is Doc Teams. Dr. Rachel is on the cam. We're at Desert Brain and Spine. If you're looking to get any of the supplementation, you should be able to check our website at desertbrainandspine.com and go to shop and just check out the supplementation stuff, and you can just order straight from there pretty soon here. Okay? If you guys have any questions, just holler at us. We can set up a consultation, check you out. Hopefully, if you're dealing with concussion stuff, I think we can do okay of a job to get them out of it.
Yes.
Okay,
Definitely.
cool.
Yes.
Other than that, you guys have an awesome day, and thank you so much for listening. We'll catch you next time.
See ya.